I think we have some interesting things to talk about in this session. It's not the technical side of things, but much more related to the governance. How do you organize properly to get access to data, to get it reused properly, and also legal basis and legal compliance, what we are going to address. Myself, I work for the Luxembourg National Data Service, which is a governmental institute in Luxembourg. I have a background in the health technology industry with Philips for a very long time. I'm also active in the Gaia-X Association, European Data Spaces Association. I'm in the board there. I support the Data Space Support Center. And that allows me also with my job for the government and these associations to have a very broad sight about data sharing structures in multiple domains, because it's not only the health domain who struggles with this. There are many common patterns between data sharing requirements, processes and tools in various other domains. And with our institute in Luxembourg, we are able to really look across and look for common patterns, common tools across these domains. Health domain remaining one of my passions, given my background as well. This is how our organization works. We try to be very pragmatic and also actionable. So we collect or we work with our data partners. They can either be providers of data or consumers, most cases both, and we do some matchmaking between them. We are centered to focus on data that is held by the public sector. Now in Luxembourg, almost 100% of the health sector is public, so that includes the entire health sector. And on the user side, we may support other public institutes, administrations or public research institutes, but also private organizations we can support in their path to get access to this publicly held data. We do that by running data projects, 3 to 6 month engagements, where we try to solve at least one concrete issue for them and accelerate their path to data. For that, we've developed a service portfolio with diverse capabilities, which can go from cataloging data, metadata management, support in the access to data, including legal support if the problem is there, data quality issues, so data curation, and if need be, even analysis or visualization support. So all across the domain. Always with the focus, each project should create some positive impact. So this is our generic way of working. We are 2 years old, so quite fresh still. And at the moment, we have 70 of these projects in our funnel. Around 12 have finished, another 25 are active, and a long tail of projects is in planning. So it's a quite intense running engine already. Now focusing in on FAIR, and how can we facilitate or lower the burdens for access to data? It's about finding, accessing, combining, and using the data. And in all of these areas, there can be issues and trouble that needs to be solved. Many cases, people don't even know where to find the data, where to go, who has what. Also, there may be an information that somebody has data, but what is the quality status of that data? Is it even usable for my purpose? So that's the first problem. Then access issues. Many often people are catched by various DPOs or compliance or data authorities. From the viewpoint of the researcher, they say they make my life difficult. From the viewpoint of the regulatory, well, it's the researcher that doesn't make the life of the compliance officer easy. So, and I think there, I'm sure Cécile will talk more about that. It's this matchmaking or this collaboration between the research or clinical experts with these data authority people that we still can improve a lot, and that's also what we try to support. Often the data does not come from one single source. People are so focused on getting this one data set from one hospital, but in most cases you need to combine data from multi-sources, also from other domains, socio-economical, for example. So how do you do that? I have to say we're probably not very mature in Europe about that yet. And in the end, you need to create, allow the use of that data in a trusted environment, which typically means don't send a copy of a CSV file, but use other means to process that data in a secure environment. All of these aspects need to be treated in order to make the pipeline work. So it's a multifaceted challenge. FAIR principles is something that we also underscribe and actively contribute to. The principle is very simple. How you do this is much more complicated and elaborated. And it needs capability building, training, it needs tools, it needs awareness, and it needs a lot of best practice sharing. Luckily, a lot of that is happening on the European level, but still, if you see how much of the FAIR capabilities are brought to practice, there's ample room to improve. FAIR is about making the data findable, really stepping up our actions to make the data catalogs really represent reality and all the valuable data sets being properly described with metadata in a catalog that can be searched. And there AI nowadays helps a lot with extracting sensible parameters from the data and hopefully will accelerate making more data findable. Next step is making it accessible. There also the data access criteria needs to be much more improved, standardized, and also made machine readable so that you can include in your query what are the access conditions. Interoperable, historically that has been worked on very much in the health domain with plenty of standards being available, also converter tools being available from one standard to another. And then in the end, reusable, also make sure we can close the loop and any result that is achieved, feed it back into the system, the results of a research, add them back into the catalog such that the engine can keep running. So this is something we fully underscribe, and I think if more parties would do so, will clearly lead to more quality data to be added and made available for research. From here, I will give it over to Cécile.
Thank you very much, Bert. Very interesting, and indeed lots of challenges around this FAIR data notion. Well, thank you for being here. So my name is Cécile Théard. I'm a French lawyer and working a lot in healthcare and also the digital economy, and I'm mixing the two, and this is really exciting for me. So data is in the middle. And the FAIR data notion is interesting. I'm going to show you this slide. It's interesting because it has not a dedicated legal tool for itself. We don't have the Fair Data Act in Europe or any international treaty on fair data, but it is coming like a red line. For example, in OECD guidelines, the European Commission also has published a number of guidelines relating to fair data. Usually it's linked to open research, so how we ameliorate the sharing of data for enhancing cost effectiveness, better innovation, better support, etc. So what we found, and you see the galaxy, and you see the kind of legal arsenal we now have in Europe, cybersecurity rules, data rules, AI rules, everything is entangled. Sometimes not so much easily connecting themselves, these legal tools, but well, we work on it. And also we have national legislations which are implementing these rules or which are coming on top. For instance, in cybersecurity, which is a part of the fair data economy because it's secure the data we have in France. For instance, we have these rules in national rules in cyber plus the EU cyber rules. So interesting to note that this fair data notion is not having a legal framework of its own, but it's coming and it's mentioned in a number of texts. For instance, very important Data Governance Act text. You see that in one of the recitals of the text, so it is there as a core principle, and we should follow, among other principles, this fair data notion. What we really see maybe as a real legal implementation of that, it's the notion of fairness and reasonableness. You see that in all the data-related texts in Europe, GDPR, for instance, the Data Act, and and so on, the Data Governance Act. But what is really much focused on is reusability, so the R of the FAIR concept. And reusability is really at the very core level of our EU legislation, especially in the healthcare domain, because you know that we have a European Act on the health data space, not yet finalized, but about to be finalized. And this is very much about primary use and secondary use. So we have this implementation and we have no guidelines. And you were talking about challenges. Indeed, we should work on that. It's not yet there. We need use cases. We need communities working together to push walls and also accept to come back on certain principles. I take the example of this regulation of the EU about the health data space, talking about opt-out, so ameliorating the access. So you will only be able to object to the use of your data for reuse and no longer have to consent. But if you look, for instance, at the medical device sector and clinical investigations on medical devices, you need to consent to your recruitment and the use of your data in order to get on board a clinical investigation. So what do we do? and this is about the MDR is quite recent. It's not supposed to be adapted right now. So and it also has an impact, this FAIR data, on the GDPR. GDPR is about the protection, but also free circulation of personal data. It's in the very title of it. But we may have to consent, we may have to opt in and not opt out in a number of situations. So this is where we are standing. I see we still have 2 minutes, so I will be happy to hear questions and discuss with you and Bert about that instead of a long speech. I'd be happy to share the slides as a takeaway if you deem interesting. And if you have questions, please share them with us. I'll be happy to hear them. Have you heard before? Had you heard before about the FAIR data concept? If you can raise your hands. Yes. Okay. Good.
Do we have any questions from the floor? There was one coming.
Hello. Thank you for the talk. It was really nice, informative. Just a comment. I work with the European Union on a project where we produce open science data. And so we follow the FAIR principles. Mm-hmm. And so, but the thing is, I also work for a pharma company, and we're really closed about our data, and we don't share it. But then I feel like more and more there's this trend of pharma companies opening up their data and sharing it for open collaboration in science, and I think that's a great direction things are going in. Mm-hmm. But do you come across specific challenges relating to data sharing within the EU or when working with Americans and things like that? Do you have anything particular that comes to mind?
Yeah, first of all, thank you, because it's interesting to see that you are concretely already implementing that. So it gives like concrete examples. It's good. And yes, personally, I meet this kind of US, EU circumstances quite regularly, and the story is very much different, and some clients come and say, well, Cécile, can I accept Amazon's offer for 50 euros per patient file? I'll be able to share the data and access new data on the platform. Well, apparently, I am the data controller, so not the platform, but it's easy. How can I do that? Can you give me your go-ahead? So concretely, this is the questions, the type of questions I have, and the universes are truly different in that. So it's not fair, it's more lucrative, and whereas we are implementing the FAIR, trying to implement the FAIR concept. So.
Many thanks for your presentation. Just one question, because you evoked the MDR, which is now harder to get than the 510K in the US. Great job, Europe. And with all those regulations, MDR, which is more harder, far away harder than 510K, is the Europe losing the war against US for the data engineering and innovation?
I would say no, because I'm first optimistic, and I'm just really able to testify on the field, because I'm working for people, you know, that the GDPR, for example, first of all was looked at, again, the story of regulation by Europe and so on. And now things have changed on the field. And a lot of countries are getting on board, trying to do the same or more or less the same with an authority and the same rules. So in fact, on the GDPR, the game has changed. I can testify that at my level. But then with new texts such as Data Governance Act, AI Act, etc., it's quite too early. But maybe we will have the same phenomenon.
I'm also a glass half full person, so I think these regulations have a lot of potential. Yeah. And me thinking as a citizen, I absolutely want my fundamental rights to be protected much more than in the US and in China, and that's why I live here and not there. So that's a fundamental choice. Now, in the execution and the implementation of these acts, there's still ample room for improvement. But I think the law text does not make it necessarily so hard. It is that we lack training and competence for the people who need to interpret and judge it, and we lack tools. And that's where I think a lot still needs to change. That's also with Gaia X, where we try to work on regulatory compliance tooling in order to make these the documentation burden, for example, easier, to have ways to electronically share certificates instead of uploading PDF files of some certificates, right? So there's a lot in the implementation that can still be done. But principally, I think Europe is striving for things we want, and now we have the challenges to translate it in something that in daily life is also practical. But in essence, it should not limit data innovation. Maybe temporarily it will slow us down a little bit, but fundamentally, these acts are not slow. It's the fact that we can't work with them properly yet.
What I see on the field is a need for visibility and also guidelines. And we can work very much on certification and standards, because this is a universal language, or almost universal, trans-frontier at least. And this is something organizations can work on practically. So I'm personally believing in that kind of tools, and guidelines from the authorities would be very useful with use cases, interpretation, and so on, because this is what organizations need to be able to follow. It's quite good sense, you know, but with a real use instead of a lot of legislation.
European Health Data Space will impose also a health data catalog to be built. If that catalog has proper data access criteria in the metadata, that will all again simplify a lot access request. Today, each access request starts from scratch, with human people reading 20 pages of text. That can be done much more efficiently if the data sets already have their access criteria defined.